Question 53. Which regarding popular artery aneurysm is false? It should be treated only when symptomatic. Popular artery aneurysm should also be treated when it is asymptomatic, so it's false. 54. Myasthenia gravis, accretion anterior meningeal mass. CT scans with poorly defined margins, areas of lower measure, several areas of calcification, one most likely diagnosed atypical pneumoma. The patient has myasthenia gravis. Accretion anterior meningeal mass and CT scans with poorly defined margins with lower measure, stable area of calcification in thymoma. So this is atypical thymoma. Benign shows no stable calcification. Carcinoma shows invaded great vessels, and atypical thymoma shows stable calcification. Question 55. T1W1 transmute high signal and thinning of the myocardium of the right ventricle, with dilation of the right ventricle and right ventricle output tract muscular diagnosis as myogenic right ventricular dysplasia. It also shows fatty replacement of the right ventricle. So T1W1 transmute high signal and thinning of the right myocardium shows that T1 high is fats, so it has fatty replacement of right ventricle. And then right ventricle is dilated and right ventricle outflow tract is dilated, so diagnosed as myogenic right ventricle dysplasia. 56. Poland syndrome classic finding is absence of the sternal head of pectoralis major. Poland syndrome, the pectoralis major muscle is absent, so it is classical finding. 57. Such aggressive pattern of pulmonary edema most likely causes acute mitral valve insufficiency. Batwing pulmonary edema is seen in acute mitral valve insufficiency. 58. Droplet sound through the occlusion of the axillary and subclavian vein. Myogram of external compression from cannulated muscle. Diagnosis is Baker-Rotter syndrome. It is also called effort syndrome. When patient applies effort, so there will be occlusion of axillary and subclavian veins, and a myogram is external compression from cannulated muscle. So diagnosis is Baker-Rotter syndrome is also called effort syndrome. 59. Such aggregates with convex appearance to the hyla with a right paratarsial stripe that measures 1.5 cm, top lymphadenous sarcoid. When there's convex hyla, there's bilateral lymphadenopathy, and then there's right paratarsial stripe that measures thickened 1.5 cm, diagnosed sarcoid. 60. CT coronary angiography shows slop plaque in the proximal left anterior descending artery, which is causing 40% stenosis by an area, and calcified plaque in the right coronary artery, which is causing 50% stenosis by area. What is the most likely appropriate next step? Lifestyle and risk factor modification. Now in coronary angiography, there are plaque in the proximal anterior descending artery and causing 40% stenosis, and then another plaque in the right coronary artery causing 50% stenosis. So what is the most appropriate next step? Lifestyle risk and risk factor modification. 61. What feature shows that the imaging appearances are secondary to pectus excavatum? 7. Rib appearance to the rib. 7. Rib appearance to the rib is seen in pectus excavatum. Question number 62. Male mechanical digital ischemia, catheter angiogram shows occlusion of the distal ulnar artery and abrupt occlusion of some of the digital arteries, which is diagnosed as hypotenuse Hammer syndrome. Now, patient is a mechanic, then he has occlusion of the distal ulnar artery on catheter angiogram and abrupt occlusion of some of the digital arteries, diagnosed as hypotenuse Hammer syndrome. Because ulnar nerve supplies hypotenuse muscle. So ulnar artery occlusion causes hypotenuse Hammer syndrome. Question number 63. Mass in the left apex adjacent to the spine. CT scan shows widening of the neural foramen on the left side with continuity with the left apex mass. Mass equals to 2.5 cm in diameter and has estimated value of 4 HU, most likely diagnosed lateral meningocele. Now you exclude other answers and then you will get this answer, lateral meningocele. There is a mass on the left apex and then CT scan shows widening of the neural foramen on the left side and on estimated value of 4 HU, so it is most likely a fluid-like attenuation, so diagnose it lateral meningocele. Exclude other answers. Question 64. Chest pain shows typical onset of atypical angina. ECG and troponin are normal. To best assess further what to perform next, CT calcium score. Because he has no angina, so and ECG and troponin are also normal. Then according to NICE guidelines, British NICE guidelines, we do next CT calcium score. 65. HRC is bilateral peripheral areas of consolidation and ground vasopressors, peripheral eosinophilia, and on routine blood tests. Which medication is the patient most likely to be on? Nitrofurantoin. Because nitrofurantoin is a drug that causes eosinophilia. Nitrofurantoin causes eosinophilia, so patient has HRCT bilateral peripheral areas of consolidation, and then peripheral eosinophilia is noted on routine blood test. Which medication causes it? Nitrofurantoin. 66. Chest X-ray is bilateral upper lobe consolidation with nodular opacities and cavitation. Negative for microbacterial infection. Aspergillus titers are positive. How is the process being described? Semi-invasive aspergillosis. Now here they tell you that Aspergillus titers are positive, so diagnosis is aspergillosis. But bilateral upper lobe consolidation with nodular opacity and cavitation, and negative for microbacterial infection, so semi-invasive aspergillosis. Aspergillus titer positive, but negative for microbacterial infections, diagnosis semi-invasive aspergillosis. 67. Past 3 weeks, calf pain at rest, relieved by dependency of the foot. The popliteal and tibial pulses are absent, with diagnosis sclerotic limb ischemia. Because there's calf pain at rest, but calf pain at rest is critical ischemia, and then popliteal and tibial vessel pulses are absent, so critical limb ischemia. 68. Which is recognized sign of pneumomyostinum? Spinator or thymic cell sign shows pneumomyostinum. Spinaker or thymic cell sign shows pneumomyostinum. 69. Chest pain on excretion. Exertion, CT coronary angiography, which is most significant? The RCA, right coronary artery, rises from the left coronary sinus and passes between the artery and pulmonary artery. Coronary artery anomaly. The chest pain on exertion and CT coronary angiography is performed. Which is most significant to cause chest pain? The right coronary artery rises from the left coronary sinus. The right coronary artery rises from the left coronary sinus and it passes between artery and pulmonary artery. So this is most significant to cause chest pain. The right coronary artery should rise from the right coronary sinus, but here it rises from the left coronary sinus. 70. Ichthyodysplasia. Relative X-rays with abnormality in the retrotracheal space, radar triangle. Which correctly describes an abnormality in this area and the effect it will have on the retrotracheal space? An enlarged aorta bulges into the anterior aspect of the retrotracheal space. So, patient relative X-ray shows abnormality in the retrotracheal space. Which correctly describes abnormality in the retrotracheal space? And so, an enlarged aorta can bulge into the inferior aspect of the retrotracheal space. We call it dysplasia. 71. Right side calf claudication, not setting with best medical therapy. MRA shows occlusion of the right common and external iliac artery. Recommended treatment for this type of lesion is surgical bypass. The patient has right side calf occlusion. Then it is not medical treatment is not successive. So how to, and then there's also occlusion of the right common and external iliac artery. So what treatment next? Surgical bypass. 72. A mass within the heart on CT thorax. There is contrast enhancement of the mass, where this mass most likely to be metastasis. Mass inside the heart on CT thorax, and then there's also contrast enhancement inside the mass and the heart, most likely causes metastasis. 70%, 73. Episode of ventricular tachycardia. Such occurs with bifid ribs. Cardiac MRI shows well circumscribed abnormality, low signal on both T1 and T2 waves, and shows delayed enhancement in the myocardium of the left ventricular free wall. Cerebral software intonation mass with calcification, most likely diagnosed fibroma. Now it is on MRI it shows well recognized abnormality, low signal on both T1 and T2 are fibers, fibroma. Low signal on both T1 and T2 are fibroma, fibers. 74. Cardiac MRI, which definite contraindication, none of the above. Cardiac MRI, definite contraindication is none of the above. Pacemaker is not a definite contraindication of cardiac MRI. Pacemaker is relative contraindication of cardiac MRI. Pacemaker is relative contraindication of MRI. Question number 25. Woman is about 28 weeks pregnant with suspected pulmonary embolism. But investigation should advise immediately venous ultrasound. Suspected pulmonary embolism, but initial investigation venous ultrasound.